Welcome to this introduction to the new GRI 403 Occupational Health and Safety 2018 reporting standard. In this video, you will learn about the key features of the standard and how to apply it. The Occupational Health and Safety 2018 reporting standard is one of the GRI sustainability reporting standards. Also known as the GRI Standards, they are the most widely used framework for sustainability reporting. The GRI Standards, which reflect global best practice, are designed to help organizations to communicate about their impacts on the economy, the environment, and society. In other words, they are designed to show how companies contribute, positively or negatively, to the goal of sustainable development. Close to 4,000 organizations around the globe use the GRI Standards. And more governments and market regulators are adopting policies to encourage and regulate sustainability reporting. More than 100 policy instruments in 56 countries and regions and in 35 stock exchanges reference the standards already. Reporting publicly about a company's impacts, including occupational health and safety, has many benefits. For one, it provides the necessary information to everyone to understand how a company is contributing to sustainable development. This drives improvement within organizations and informs decision makers, like investors or governments. It also creates the basis for a constructive dialogue between companies and their stakeholders. The GRI standards are modular. There are 3 universal standards that apply to every organization that wants to report on its sustainability efforts. The starting point is GRI 101 Foundation, which sets the principles for defining the content of the report. GRI 102 General Disclosures is used to report on the contextual information of the organization and its reporting practices. And GRI 103 Management Approach is used for reporting on how organizations manage each topic that is material. Material topics are those that reflect the economic, environmental, and/or social impacts, and therefore the contributions, positive or negative, towards the goal of sustainable development. GRI 103 is designed to be used together with the library of topic-specific standards. The 33 topic-specific standards are designed to report specific information on a wide range of topics, including water, anti-corruption, and of course, occupational health and safety. Each organization can select from the topic-specific standards to report on their material topics. Because the standards are modular, they can be updated independently to respond to new developments and stay up-to-date and relevant for reporters. This is what we've done with GRI 403 Occupational Health and Safety. You can download the GRI standards for free on the GRI Standards website, together with more information on how to use standards, training materials, and translations. The process of developing or updating a standard, like this update of GRI 403 Occupational Health and Safety Reporting Standard, is overseen by the Global Sustainability Standards Board, an independent standard-setting body of GRI. All standards are developed through a transparent and inclusive process and in the public interest. The information about the standard-setting process is on the GRI website. The content of this standard was developed by a multi-stakeholder working group with leading experts from labor, civil society, investors, business, and international and governmental institutions from around the world. Working group members include representatives from the International Labour Organization, the U.S. Occupational Safety and Health Administration, the Center for Safety and Health Sustainability, and the Institution of Occupational Health and Safety, among many others. A draft of the standard was also released for public comment and received close to 600 comments from stakeholders. Please visit the project page for more information about the review process. GRI 403 Occupational Health and Safety, which aligns with the Sustainable Development Goals, has been revised to meet the following objectives: to represent internationally agreed best practice and incorporate recent developments in occupational health and safety management and reporting practice, to harmonize with key instruments from, for example, the ILO and the newly released ISO 45001 standard. It was also important to address some of the most common challenges in measuring and reporting occupational health and safety impacts. For example, information is often difficult to compare because there are many different methodologies to measure and report. Lagging indicators predominate over leading indicators. Leading indicators are needed to understand how well prepared an organization is to prevent injuries and ill health from happening in the future. There is an over-reliance on productivity measures, such as lost time injuries, which do not always indicate the extent of harm on workers or whether workers have been able to recover fully from work-related injury or ill health. And health risks related to lifestyle are increasing, such as poor diets and lack of physical activity, which may be aggravated by work or may reduce the ability to work. So there is a need for a broader view of occupational health and safety. In short, this standard was revised to drive improvements in occupational health and safety and the lives of millions of workers. Now, let's see some of the key features of the updated standard. The standard includes a new section on whose occupational health and safety organizations are responsible for and what kind of workers should be included in reporting. So, in addition to employees, the standard covers other workers whose work or workplace is controlled by the organization. Organizations are expected to report on workers where there is control of the work or control of the workplace at the same level of detail as for the company's own employees. Plus, the standard covers cases where there is no control of the work and the workplace, but the organization is directly linked to impacts on the health and safety of workers by its business relationships. In these cases, even if the organization has no control of the work and the workplace, it is expected to explain what it is doing to prevent and mitigate those impacts, as well as the related hazards and risks identified. The standard allows organizations to communicate on their efforts both to prevent harm and to promote workers' health. It asks companies to explain what they're doing to prevent work-related injuries and ill health, which is still the primary focus of the standard and the primary responsibility for a company. But also asks what companies are doing to help workers stay healthy outside of work, for example, by providing access to healthcare or offering voluntary programs for workers to improve their diets or quit smoking. The standard now includes specific management approach disclosures, which reflect key leading indicators like the presence of a management system based on recognized standards or guidelines, or active engagement and training of workers. The standard places a greater emphasis on identifying hazards, assessing risks, and applying the hierarchy of controls. All these are key to understand the efforts that a company is making to become aware and address hazards that may lead to injuries or ill health in the future. Compared to the previous version, health has also become more important. For example, data on ill health has been separated from data on injuries, and there are new disclosures that focus on occupational health services and worker health promotion. To understand the severity of an injury, the standard looks at recovery time, which is the time it takes for a worker to get back to pre-injury health status, instead of what is commonly done, which is to look at how much time it takes for the worker to return back to work. This places the focus on measuring the impacts of a work-related injury on the worker, as opposed to measuring the loss of productivity for an organization, especially considering that in many cases a worker may return before he or she has fully recovered. Finally, the standard includes improved methodologies for measuring and reporting work-related injuries and ill health, which will make this information more consistent and comparable between companies going forward. For example, in addition to asking for standardized rates on injuries, the standard also asks for the absolute data to be provided to facilitate the analysis for those who use this information. We will now look at the contents of the standard. The first section explains the scope of workers to be covered when reporting with GRI 403. It contains detailed guidance and explanations, as well as numerous examples of workers to be included in the report. Here you see an overview of all the disclosures included in the new GRI 403 Occupational Health and Safety Standard. There are 7 disclosures for an organization to explain its management approach towards occupational health and safety. And there are 3 topic-specific disclosures to report on key elements of performance and impacts. These include disclosures on the extent to which workers are covered by an occupational health and safety management system, and data on work-related injuries and ill health. Each disclosure can have additional requirements on how to compile and present the information, along with recommendations and guidance. The requirements set basic expectations for reporting using a disclosure and are as universally applicable as possible. Recommendations reflect new trends and leading practice related to a disclosure, but might not be achievable for all organizations because of the level of transparency or detail they entail. Recommendations are also the place for organizations to disclose their best practice in occupational health and safety reporting. Guidance includes background information, explanations, and examples to help reporters understand the requirements and recommendations and compiling the data for them. The next slides give an overview of the information required in each of the disclosures. Disclosure 403.1 requires a statement of whether an occupational health and safety management system has been implemented, and information about legal requirements and recognized standards or guidelines at the base of that system. In addition, it requires describing the scope of workers, activities, and workplaces covered by this system. Disclosure 403.2 covers the processes for identifying hazards, assessing risks, and applying the hierarchy of controls, including how an organization ensures the quality of these processes and how the results are used to evaluate and improve the management system. One important concept here is the hierarchy of controls. The aim is to protect workers by ranking the ways in which hazards can be controlled. Each control in the hierarchy is considered less effective than the one before it, so eliminating the hazard is the most effective control measure applicable. But if that's not possible, the next control in order of effectiveness is to substitute the hazard with less hazardous processes, operations, materials, or equipment. This concept and the list of preventive and protective measures in order of priority are based on the ILO and ISO definitions. Disclosure 403.2 describes reporting on the processes that allow workers to report work-related hazards and to remove themselves from work situations that they believe could cause injury or ill health, and the processes related to incident investigation. Disclosure 403.3 focuses on the relevant occupational health services implemented by an organization, including how it ensures the quality of these services and facilitates workers' access to them. Occupational health services have essentially preventive functions and are responsible for advising the employer, the workers, and the representatives on what is required to establish and maintain a safe and healthy work environment. They can be, for example, surveillance of sanitary installations and advice on ergonomics or protective equipment. For Disclosure 403.4, an organization describes the processes for worker participation and consultation in the development, implementation, and evaluation of the occupational health and safety management system, and the processes for providing access to and communicating relevant information on occupational health and safety to workers. Also, if there are formal joint management worker health and safety committees, the organization is required to report about them and explain whether any workers are not represented by these committees and the reasons why. Disclosure 403.5 focuses on worker training, including generic occupational health and safety training and training on specific work-related hazards, hazardous activities, or hazardous situations. Disclosure 403.6 covers the promotion of workers' health. This disclosure requires information about workers' access to non-occupational medical and healthcare services and any voluntary health promotion services and programs offered to workers to address major non-work-related health risks. The guidance for this disclosure provides examples of voluntary health promotion services and programs, such as stress-reducing programs and fitness programs. Besides, it highlights that both occupational and non-occupational health services and programs are expected to respect workers' right to privacy. The last management approach disclosure requires a description of the organization's approach to preventing or mitigating significant negative occupational health and safety impacts that are directly linked to its operations, products, or services by its business relationships, and the related hazards and risks. So, as said before, even if the organization has no control of the work and workplace, it is expected to make efforts to prevent and mitigate negative impacts that are directly linked to its activities. Next, there are the topic-specific disclosures. Disclosure 403.8 requires quantitative data on the number and percentage of employees and other workers who are covered by the Occupational Health and Safety Management System implemented by the organization. This includes data on the use of internal and external audits or certification. Some organizations may not have quantitative data for all workers within the required scope. So all the topic-specific disclosures, including the next two, include a requirement for the organization to explain whether any workers have been excluded from the disclosure, including the types of worker excluded and the reasons for their exclusion. In addition, all topic-specific disclosures require any contextual information needed to understand how the data have been compiled, such as any standards, methodologies, and assumptions used. Disclosure 4039 covers work-related injuries. It requires organizations to report the number and rate of fatalities as a result of work-related injury, the number and rate of high-consequence work-related injuries that were not fatalities, the number and rate of recordable work-related injuries, the main types of work-related injury, and the number of hours worked. As mentioned earlier, the number of hours worked is required so rates can be easily calculated when analyzing data with different methodologies. The same set of data is required for workers who are not employees but whose work or workplace is controlled by the organization. An important concept introduced here is high-consequence work-related injury. This refers to an injury that results in a fatality or in an injury from which the worker cannot, does not, or is not expected to recover fully to pre-injury health status within 6 months. This helps shift the focus of reporting from loss of productivity for the organization as a result of a work-related injury to evaluating the impact on the worker's health and safety. Organizations are also required to report on work-related hazards that pose a significant risk of high-consequence injury and actions taken to eliminate this and other work-related hazards. The standard allows for the use of either 200,000 hours or 1 million hours worked for calculating the injury rates. Therefore, the reporting organization is required to state which of the two options was used. The standard includes important guidance supporting the compilation of data on work-related injuries. For example, it includes guidance on determining if an injury is work-related or how to report on commuting incidents. It also recommends that organizations report high-potential incidents and close calls, and that they break down data by type of injury, country, business line, or workers' demographics where relevant. The last topic-specific disclosure covers work-related ill health. It requires organizations to report the number of fatalities as a result of work-related ill health, the number of cases of recordable work-related ill health, and its main types. It also requires reporting the work-related hazards that pose a risk of ill health and how these are eliminated or controlled. In this context, ill health is used to indicate damage to health in general, and it includes diseases, illnesses, and disorders. The standard also includes important guidance supporting the compilation of data on work-related ill health. For example, there is guidance on reporting on musculoskeletal disorders and on mental illness. It also recommends that organizations break down data by type of ill health, country, business line, or workers' demographics where relevant. The last two sections of the standard are a glossary with definitions for key terms used and a list of references that may be helpful for understanding and applying the standard. The following explanation on how to use the standard is relevant to organizations looking to prepare a report in accordance with the GRI standards. The number of disclosures to report on depends on whether an organization has chosen the core or comprehensive reporting option under the GRI standards. As said before, GRI 103, the Management Approach Standard, is designed to be used together with each topic-specific standard to report the management approach for any topic. So, when an organization has identified occupational health and safety as a material topic, it is required to report its management approach for this topic using the 3 disclosures in the Management Approach Standard and the 7 management approach disclosures in GRI 403 Occupational Health and Safety. This applies for both core and comprehensive reporters. In exceptional cases, if an organization cannot report on some of these management approach disclosures, it can use reasons for omission. Only disclosure 1031 cannot be omitted. GRI 403 includes 3 topic-specific disclosures. Disclosures 403.8, 403.9, and 403.10. The In Accordance option determines how many topic-specific disclosures an organization is required to report. If an organization prepares its report in accordance with the core option, it is required to report at least one of these specific disclosures. An organization that prepares its report in accordance with the comprehensive option is required to report on all topic-specific disclosures. Reasons for omission are permitted for all topic-specific disclosures if, in exceptional cases, the organization cannot report on this. The new GRI 403 Occupational Health and Safety 2018 standard will be effective for reports or other materials published on or after 1 January 2021. This means that its use is required from that date, but earlier adoption is encouraged. GRI 403 Occupational Health and Safety 2016 can continue to be used for reports or other materials if they are published on or before 31st December 2020. But since the new standard represents leading best practice on occupational health and safety reporting, existing users of GRI 403 are advised to start using the new standard right away, even if they cannot yet meet all requirements needed for core or comprehensive. An organization reporting on GRI 403 Occupational Health and Safety for the first time is advised to start reporting with the new standard. If you need more information, please refer to the frequently asked questions about this standard on the GRI Standards website. And for any other questions that are not covered there, you can send us an email to standards@globalreporting.org. Keep an eye on the GRI Standards website for the upcoming translation schedule. To learn more, you can join one of the live webinars where GRI will respond to questions from the audience. A morning and an afternoon session are planned on 20 September. Register for these sessions by clicking on the links that are available in the description of this video, here below. Thank you for listening. We hope this has given you a good overview of the new GRI Occupational Health and Safety Reporting Standard. We invite you to download the standard from our website, if you haven't done so yet, and to get started with it. Thanks again, and goodbye.